Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome back to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And that's why we're honored to have with us Dr. Melissa Caldwell, President of Freedom Behavioral Health, Inc., and Josh Young, Director of Behavioral Health and Outreach Services. And when you talk about Freedom Behavioral Health, it's part of the Advanced Correctional Healthcare family, which was recently honored as a 2024 Torch Award winner with the BBB serving Middle Tennessee and Southern Kentucky. So how are you two doing?
We're fantastic. Absolutely thrilled to be here.
Thank you, Jeremy. We're excited to be here.
Well, let's go ahead and dive in because we have a lot to unpack. And so let's start when you talk about Freedom Behavioral Health, Inc. tied to Advanced Correctional Healthcare. Melissa, go ahead and start. Give us some context and some background.
Well, Advanced Correctional Healthcare has long been committed in whole person, whole patient care. And our population is probably the most acute population. They have a lot of health challenges, and those are head to toe. We are frontline for issues related to addiction, substance abuse, mental health crises. Corrections is really the largest psychiatric provider in our country at this point. So Advanced Correctional Healthcare is whole person committed, and we're part of that commitment is to make sure that we're taking care of the behavioral health needs, meaning the mental health, substance abuse, and physical needs of our patient population.
Give us an idea of geographical spread because it is far-reaching. So give us some scope and some stats.
Well, Tennessee is our home state. We're very, very proud to be here. But we are across 22 states, going as far out west as Arizona, all the way nearly to the Canadian borders, and now to the eastern seaboard and down to the Gulf. We've grown organically as a family company. And this company cares more than just about the business line. It really is about the family reputation. I think Josh can speak to that as a member of this prestigious family who've really empowered us to do the right thing. I left state government work because I was so impressed with the integrity of the leadership, and I'm proud to call myself as part of the ACH family.
Well, Josh, go ahead and dive in because let's start, carrying this culture conversation, which is a big part of why you all were honored. So go ahead and dive into some of the parts that really put a smile on your face.
As Dr. Caldwell said, I am a part of the family. My wife's grandfather actually started the company about 25 years ago because he saw a need to help the people in the correctional facilities. And each and every day we kind of try to step up and do the right things for our patients. And as Dr. Caldwell said, we're in 22 states, and we're in 370 plus jails, and we have a wide range of jails. We go to jails that in tiny rural parts of the country where we only have maybe four people in a jail to maybe having 1,200 people in a jail. So no matter where we are in the country, no matter what city or how big the jail is, we always just try to step up and do the right things for our patients.
Let's go ahead and dive in on the culture side because when you talk about what your team does, it's hard work. And when you talk about the mental side of it, there's a lot that goes in terms of equipping, empowering, taking care of your team. And empowering is a big piece of what you all do, empowering them to make the right decisions and to be good stewards of those opportunities. But also there's professionalism, integrity, and commitment, pick. And so talk about some of those aspects of really empowering your team and why that's important for well-being.
Well, I mean, part culture is not just a talking point, it's really living it. We live by our core values. Our core values are receptiveness, leadership, but it's all comes down to the umbrella of professionalism, integrity, and commitment. We don't recognize professionals based on deeds. We recognize them based on the underlying core values, and that's what we aspire to. We're challenged to look for those good deeds driven by core values, and also to embody that. Our leadership, Dr. Johnson, Dr. Moriarty, they even wrote a leadership book. And we really do live by that in terms of those pieces, those life lessons. This company has grown me as a leader. There's so much that I do that is inspired by, those teachings.
Josh, carry that into when you look at PIC, when you look at professionalism, integrity, commitment, the mole interview method you all use. Go ahead and talk about why this is so important to focus on empowering your team and lifting based on those dynamics.
We kind of have those standards as a way of driving our company in the right direction. And the MOLE stands for Make Our Life Easier. So we want everyone in our company to kind of work to not just look internally at what they can do for themselves, but what they can do for others and how they can make other people's lives easier and make ultimately then the lives of our patients easier, how we can help them and grow them in the right direction, because that's what this is truly about. It's obviously about our employees and about us, but it's truly about the patients and how we can kind of change their lives for the better, because they are one of the most underserved populations in the country who often get forgotten. And that is truly why we do this, is for them and to find ways to help them kind of get back on their feet and change their life for the better, because obviously something went astray if they're in jail. And so we want to be there to kind of figure out how we can make them better and get them back on their feet.
Talk about how this work ties to recidivism and really to also on the other side with first responders, helping them as well. So talk about kind of how this is creating an impact.
I mean, this is about the big picture. So Josh talks about, starting with us as the professional, going into our work with our patients, but this is not an island. These facilities, these agencies are not contained units. They're part of a larger community. And so we're taking care of the individuals that are tasked to us. At the same time, that is a son and daughter and a husband and wife and a parent. And if we can do well by them and help them get on a better trajectory of health and citizenship, the impact for the community is immeasurable. We aren't just trying to take care of these little brush fires. We want to make sure that we're thinking more big picture. These are individuals, most of them will be back in the community in the checkout lane with you and our parents. And I think there's a responsibility for us to do right by them so that they leave healthier and less likely to hurt themselves or hurt others. And in terms of the community piece, the first responders, I think we talked about how Advanced Correctional is committed not just to the jail walls and what's within it. It's a community commitment. So we take care of all first responders. So whether that's law enforcement in the facility, in the field, dispatch, fire and rescue. Josh can speak to what he does for firefighters in the state of Tennessee. All those individuals that are frontline in caring for people in crisis.
Yeah, carry that forward, Josh. And then also you don't have to name specific names, but give us a little bit of an example of how this plays out.
So a big piece of what we do is we have a position called discharge planners. And they work with our patients as they're preparing to leave the jail. And so they kind of help them get set up with resources for maybe counseling, maybe housing, maybe get them set up on Medicaid or Medicare. And the whole point of that is we don't want them to come back. We want them to be prepared for the real world when they leave, make sure that they have the tools that they need so that they can change their life for the better. And we don't want to see them back. And then also Dr. Caldwell said, we kind of work with the first responders. So in Tennessee, in Williamson County, we provide free of charge kind of trauma. If there's any sort of traumatic incident that happens, we provide peer support for firefighters, really any first responders, free of charge, a part of our SEER program. So these are often people as well who are expected to be heroes, who are expected to never kind of get down in a sense or let all these terrible things affect them. And so we're there to kind of step up and help them kind of walk through any sort of traumatic event that they go through.
I know that you all have a hotline and many success stories when you look at literally saving lives. And so share a little bit of maybe, one or two stories that really put a smile on your face in terms of the impact with you and your team.
I don't know if it puts a smile on my face. It's more of just a sigh of relief. We meet people where they're at, and some of our professionals are in crisis. They're giving their all, but who's there for the helper? Who helps the helper? We have had sheriffs who have taken their own lives, and so we want to save lives. So I think people think about the patients that are in our facilities, but we're there also to equip professionals and care for them and help their well-being. We had a professional who shared that in 1 week, she found out that her cancer came back. In the same week, she sadly found out that her husband was unfaithful and she needed the health insurance. So the marriage needed to stay intact. And she put her pistol in her mouth. She was at her end. And she said, we saved her life. I felt honored that she had given us an opportunity to partner with her in saving her own life. That is not an isolated story. We have had many professionals who were suicidal. We've had marriages in crisis. We've had families that were in crisis. And these are professionals who fear seeking assistance because they don't want the community at large to lose confidence in them. And so they'll allow their human suffering to fester to the point where sometimes it's the point of no return. So we're trying to change a culture and help those professionals because drowning people can't save drowning people. And so we're again trying to help them so that they can help the community at large.
Yeah. I know that you all do a tremendous amount of support, and one nonprofit in particular you all support is St. Jude Children's Research Hospital. And so Josh, talk about that.
Yeah, so we've supported St. Jude for many years. We do several at the office every Friday. We do a jeans day, which if the employees want to wear jeans, they have to donate a certain amount of money to St. Jude. Then we have an awards dinner every winter, and we do raffles at that, and the proceeds to that go to St. Jude as well. So we've been working with St. Jude for a while. So it's an organization that we have a lot of respect for and support the mission of their organization wholeheartedly. So we've been working with them on those initiatives for a while now.
Talk about how the community can support your efforts. Give us some ways that, is it raising awareness? Talk about ways the community can help.
And I love this question because I once had a sheriff say, I feel I've done my job when the people in my community don't even know where the jail is. The problem is that also means sometimes the people in the community don't know what happens in the jail. And there's a lot of mystique and a lot of misinformation. I have, almost without exception, worked with professionals who are committed to doing the right thing, true public servants. But then there's these, because we work with and employ humans, you could have an officer or a nurse or someone, again, we're human, who has done the wrong thing. But that doesn't mean it's reflective of the larger industry. I want the community to understand that this is an important public service. It's a public safety component. We are trying to rehabilitate and protect the individuals in the facility despite what might have brought them, because again, that's the right thing to do as a human to a human. But please also ask questions, learn more, and perhaps give benefit of the doubt and know that, again, these are individuals, professionals who are really trying to do right by their communities and by each other.
Josh, give me one more thing that you wish everyone knew about Freedom Behavioral Health.
I agree with Dr. Caldwell that there are a lot of our industry sometimes gets a bad rap because of a few bad stories out there. But there are a lot of truly good people who want to step up and help in this industry. And I feel like Freedom has a large number of those people because That's just what we expect from our people, and that's what we expect them to do for our patients. And we want to continue doing that for many years to come because we really, truly care about the work that we do.
What does winning the 2024 Torch Award, when you look at what this award represents with the BBB serving Middle Tennessee and Southern Kentucky, it's about doing the right thing, supporting your team, supporting the community, high ethics. So what does this award mean to you all?
It's an honor. It really validates all the hard work and the hard decisions. Again, we can't defend ourselves sometimes in the media when there's been a bad outcome. We have to protect patient privacy. We have to do those kind of things. And there's lives we've saved on a daily basis. Again, an ethics award of this caliber really helps to validate that those hard decisions, those days when you're kind of taking your licking without the accolades, that they're worth it.
Wrap up with contact information. So where can we go to carry this conversation forward to learn more about Freedom Behavioral Health?
Well, again, remember, Freedom's part of Advanced Correctional. So we have two websites, www.advancedch.com and www.freedom-bh.com. We are out of Franklin, Tennessee. Again, proud to be here. And we welcome contacts. I give my phone number directly because we're 24/7, 365, but I think the emails that are on that website is probably helpful. That's a good starting point.
Well, Dr. Melissa Caldwell, Josh Young, thank you for all you and your amazing team do to power the good. Congratulations again on your 2024 Torch Award, and greatly appreciate you coming on the show.
Grateful to you.
Thank you, Jeremy.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.